Reasons that an implant can fail include improper angulation, inadequate bone, inadequate soft tissue, and cement retention at the time the crown is placed. From a maintenance standpoint, the patient has to be responsible to treat this implant like any other tooth. They need to brush and floss and accept regular cleanings every 6 months. Smokers have a significantly less success rate. A healthy, normal person has a 98 to 99% success rate with a dental implant. With a smoker, that goes down approximately to 85% success rate. Using CT guidance, oftentimes you're able to assess the proper amount of bone. Using your clinical examination, you're able to assess the connective tissue, the soft tissue. Is there adequate amounts? And if so, treat the patient accordingly. Will they need a bone graft? Will they need a connective tissue graft? In order to optimize both the aesthetic and functional result of that implant and provide that patient with an implant that lasts a lifetime. If you have concerns that you have a failed implant, failing, pain, inflammation, please come in. We'll evaluate you, take the proper imaging, and determine what steps are possible to restore your failing implant.